All right, welcome back to another virtual shadowing session at Hearts for Health, y'all. This is actually going to be the last of this month and also one of the last of our spring semester. I did mention this during last session, but for those who are curious, we will continue with more shadowing sessions in the summer. But after this one today, for the rest of April, we will not have any shadowing sessions. We will have two more at the beginning of May, and y'all will see that when we post it on Instagram and over our listserv. I just wanted to let y'all know if you didn't catch us on Monday. But today we're excited to be joined by Kathy. Kathy is a nurse anesthetist. She is, I think, the second one that we've had on shadowing. We had Dr. Cosgrove earlier, and today we're pleasure to be joined by Kathy to talk about the field too. I have a few reminders though for y'all before we get started, especially if you're new. So just two things. First of all, at the very end of each of these sessions, we do have a Q&A. If you have any questions for Kathy about the profession, about her journey, anything to do with that, feel free to type them in the chat. We'll go through them at the end. So within the last 10 minutes, we'll have a Q&A to go over those questions. The second thing I want to say is, if you're unfamiliar to our virtual shadowing program, or if this is one of the first times that you've joined in, we do have a couple ways that you can continue to see sessions or continue to at least stay in the loop with sessions. All sessions are going to be here on YouTube, and they're going to be live streamed at the times that we have posted on our flyers. So to hear about those flyers or to receive them, you can either join our listserv, which is something available over our website. If you go to the bottom of any web page that we have, you'll see the subscription form that we have. Fill that out, you'll be added on, or you can just email us. I'm going to put our email in the chat, not in the chat, in the video description at the very end of the session. It's shadowing.h4h@gmail.com. You can email us there and also join in. And then the second way that you can also hear about us is Instagram, another way that we just post flyers. Those are my reminders. I don't want to go too long on with that, but if you do have any questions that I didn't go through that you'd like to ask us about virtual shadowing or any of our other programs, feel free to send us an email. We're going to be happy to answer any of them. But with that said, Kathy, feel free to take it away.
Great. Thank you so much, Michael. Hello, everyone. And thank you, Hearts for Health, for having me here tonight. I'm very happy to be here and share some information with you. I know it's almost Friday, so I'll make it short and sweet here. My name is Katherine Faltot. I am a certified registered nurse anesthetist. And I'll tell you a little bit about me. So I am originally from Colombia, South America. I grew up most of my life in the US, in Maryland, DC area. I went to undergrad in Washington, DC. I did my nursing bachelor's degree for 4 years there. I worked as an ICU nurse for about 8 years in different states throughout the country. And then I went to grad school to become a CRNA. Once in grad school, that was about maybe 3 years of the program. I did training in several states like Mississippi, Kentucky, Tennessee, Alabama, and I graduated last year. So I am now a CRNA. I started my job about 6 to 8 months ago, and I'm here to tell you all about it. All right. So many of you might be wondering, what is a CRNA? So a CRNA is an advanced practice provider, meaning that they usually go through school for about 4 years, become a nurse, get a little bit of experience, and then become advanced in their practice. And so for this type of advanced practice, we are specialized in anesthesia. We can work in all sorts of healthcare facilities, including hospitals, outpatient surgeries, pain management clinics, and basically anywhere anesthesia is needed, even labor and delivery room, all those areas. According to the American Association of Nurse Anesthetists, we administer about 50 million anesthetics to American patients every year, and we represent about 50% of the workforce in the US. So what does that mean? There is high demand for nurse anesthetists right now. And we're also in the military. We serve our troops. And this roughly means that for every anesthesiologist, like a doctor anesthesiologist, there is about 3 to 5 CRNAs. So for example, we all work in the operating room. There's one anesthesiologist supervising 5 CRNAs or 5 operating rooms at the same time. So what do we do exactly? So what we do is we do a little bit of everything, or pretty much everything. We do the preoperative interview for the patient. We go through their H&P history, all the medications that they take. We make sure that they're safe before they get anesthesia. Then we take them in the operating room. We do the induction of anesthesia. We're with them the whole time. Sometimes the doctor is in the anesthesiologist is in the room with us on the induction. Sometimes they're not. So it's a very autonomous profession, as you can see. We also remain through the whole procedure. We wake you up after your surgery and we take you to recovery. In recovery, we will make sure you don't have pain and that you're nice and comfortable after your surgery. We also do procedures like arterial lines, central lines, peripheral nerve blocks for pain management, spinals for C-sections or knee surgeries, and epidurals for labor and delivery. My personal focus right now, besides being a full-time CRNA, is also mentoring others to join the profession or any healthcare profession. I specifically mentor international students and Hispanic students because I'm Hispanic, so it's a little easier to interact with them, but pretty much anybody that's bilingual or trilingual, I mentor so they can join the profession, because according to the Census Bureau, we will have a lot of Hispanic minorities. We will have a great increase by year 2050. We will have 111 million Hispanics. And right now we have 60 million. So my goal is to get more people educated and get into the healthcare field, so that way we can represent and take care of our patients adequately. For anyone interested in joining the healthcare profession or the CRNA profession, you know, it's a great profession, lots of responsibility, but you do get compensated accordingly. It is one of the highest paying jobs in nursing specialties, flexible hours. It's great. If you have any other questions, feel free to email me, or you can follow me as well. I'm pretty good at answering all the DMs.
Well, first of all, thank you for getting this together. Like we said, this is something that we've seen earlier, but I think a couple of the points we didn't see earlier in terms of nurse anesthesiology, it's good to know. To start it off, and by the way, y'all, those who are listening, feel free to keep your questions rolling in as we go. We have a good amount of time for a Q&A here. So just to start it off, do you know how the whole field of nurse anesthesiology came about? Is there some history behind it that you could take us through?
Yes, we were the first ones to become anesthetists over 100 years ago. I don't know the complete history exactly, but it started with nurses, and we started administering gases and ether and other things to experiment. Before, they used to simply like take a bunch of blood out until you passed out, and then you do your surgical procedure. That's how anesthesia was back in the days. But it's quickly been evolving, and right now it's as safest as it's ever been before.
And I noticed that there were a couple credentials that you've had, DNP, CRNA, etc. Of those, how many do you need to actually become a certified nurse anesthetist?
So the DNP means a doctorate in nursing practice. I believe this year it already became mandatory to get a doctorate instead of a master's degree. It used to just be a master's degree. So the doctorate degree is 3 years, and you're able to teach, become a professor, and do things like I'm doing right now. APRN just means advanced practice provider.
Another question we have is, you mentioned CRNAs and anesthesiologists earlier, the ratio that they have in the hospital. In terms of actual practice, what's the difference between how much a CRNA can do for patient care and how much an anesthesiologist can do? Is it really the same, but is it just anesthesiologists supervising them? Is that the case?
Great question. We both do sort of the same things. Anesthesiologists obviously have a lot more years of training. So they have a lot more expertise in everything. And for example, like if we're doing an open heart surgery, CRNAs don't or can't necessarily read the echocardiogram while the patient is under anesthesia, whereas the anesthesiologist can do the echocardiogram and read all those sono images. But we also CRNAs also are allowed to have their own practice in some states, and I have actually practiced in some of those, and most of the surgeries are pretty straightforward, not very sick patients. So definitely anesthesiologists have higher training and more years of education and more hours, so they're a little more expert than we are, but we both work together. And we support each other. So yeah, like I said, almost every hospital is like, 1 to 3 or 1 to 5, but we always work under the supervision of an anesthesiologist, and also depending on the state.
The follow-up question to that is, what would you say the most difficult part of the job is?
It's different for everyone. Obviously, you have a lot of responsibility. You have people's lives in your hands. The training is very good. It makes you comfortable in your own skin, but there are times that you're worried about a very sick patient and you're not sure, you have to anticipate many things, and that's a little nerve-wracking, but as you get more experience, you get better at it and you just figure it out.
And I'm sure something that could really help a lot of these students listening in, being that they're in college, is the type of experiences that would help, that you can leverage, right, at this point, at this point of their career, for later on in school. So just to maybe set the stage and familiarize ourselves, how much experience do you actually need? Is there a requirement? Because I know, for example, with PAs, they have a requirement for clinical experience. First of all, is there a requirement for that type of clinical experience? And second of all, if there is, or I mean, in general, I'm sure that you'd recommend that there's clinical experience that undergrads take. What type of opportunities would you really recommend for people looking into the field?
So yes, experience is definitely needed. So first you have to become a nurse, registered nurse with a bachelor's degree in science. And that is a four-year degree. As soon as you come out with your bachelor's, go right into the ICU and work as an ICU nurse, preferably at a big hospital where they have very, very sick patients. You have to have at least 2 years of experience in order for you to apply to CRNA school. And then once you get into, I had 8 years, and some people had 5 years, and very few had 1 or 2 years. So experience is very important, because as an ICU nurse, you have to learn how to manage, all the IV drugs and the dialysis equipment and the ECMO equipment and open heart patients that come to the ICU and trauma patients. And so experience is very, very important. Once you get into school, it's a 3-year program. My program was front loaded. So the first year was just didactics, and then the other 2 years were clinical practicals. And so you go around different hospitals, you do OB rotations, cardiac rotations, pediatric rotations, normal medical rotations, and you learn to do anesthesia for all kinds of surgeries. I don't know if I answered your question, but
yeah, you definitely did. Actually, a student had a follow-up to that. You mentioned the application process to CRNA school. What is that application like? Maybe if you could talk through your personal experience, any tips that you have for students out there?
Sure. So the application process, like I said, 4-year degree, nursing, 4-year nursing degree, and then get into an ICU. The experience is a must requirement. Then you can get your CCRN, which is a certification. It's for critical care nurses. It's critical care certified registered nurse, and it's basically a test you have to take to make sure you can manage ICU patients. You have to have that. Then you also have to get involved in leadership. Like, for example, I was the charge nurse in the ICU. I did medical mission trips. I was always involved in my unit and preventing infections and all that stuff. So you have to kind of stand out as a leader. Some schools require the GRE. The GRE exam, I can't forget what it stands for, but it's like a graduate level entry exam. And so it has math and English, and you have to get a certain score for them to invite you for an interview. And the interview, if you get invited for an interview, is also a big thing. You have to be prepared. They can throw some clinical questions in there, and you have to be prepared to answer whatever they throw at you. So yeah, it's a little bit of a process, but it's worth it.
100%, I'm sure it is. Another thing is, like I mentioned, there's a couple other professions out there. There's a number at this point, right? There's PAs, there's nurse practitioners, nurse anesthetists like yourself, physicians. Out of those professions within the hospital, how did you narrow down your choice to being a CRNA?
Well, I always loved critical care, and I always wanted to just take care of like one patient at a time and kind of get to know them from the beginning until the end. As a nurse, you don't necessarily get to do that. You're always busy with one patient or another. I wanted to devote my attention to that just one patient for that one day or for that one surgery, and to be able to manage their hemodynamics and their body and all the body functions is just fascinating to me, like while they're under anesthesia, because they have no control over themselves once you induce anesthesia. So you're responsible for keeping the body functioning normal. And that was just pretty interesting to me.
So in terms of setting as an anesthetist, are you limited to the ORs, or is there anywhere else that you also contribute?
It depends on the state. For example, where I trained, there are CRNA practice onlys, and they can do peripheral nerve blocks. Here, for example, or some hospitals, they may not allow you to do the open hearts. The docs do those, but it all depends on, in other states, the CRNAs do everything. And so it just really depends what state you work in, what hospital you work in. But really, there's no set limitation as long as you're in a big facility that has a lot of support.
Another thing I really like to talk about, really across any profession, we've had quite a few. We have dentists, physicians, PAs joining us, and they always have something to say about this in terms of location, right? Between being in an urban area versus a rural area. What are your thoughts on how that's been, or how that is really?
Thoughts on
working there, like practicing there. What's the environment between a rural area, an urban area? What's the difference in work-life balance, just in general with your work life? How would you compare and contrast those two places?
So working in the city versus working in the rural area, I would say working in the city, you have a lot more support. For our profession, you get paid a little bit less when you work in a big city versus working in a rural area where there's, middle of nowhere and you're the only one there. You're usually have a more competitive salary. Of course, there's a lot more responsibility. But yeah, I would say that's the main difference.
Another thing I also like to ask in terms of just general professions is there's a couple instances where practitioners are able to get into spaces outside of just like one-on-one patient care. So that might be with public health, that might be with administration. And also another recent speaker, I think, talked about this specifically, about like making entrepreneurship, right? Not necessarily private practice, but more so like patents with medical devices and all that. For nurse anesthetists, have you seen that apply with colleagues? Have you seen them go down different routes as CRNAs outside of just one-on-one patient care?
I have heard of CRNAs like opening their pain clinic or working at pain clinics and treating patients that have pain problems. So obviously, I have also met CRNAs that, do coaching, career coaching, or have created some applications to guide students on what to do in a certain case. Like they create an app on your phone that you can download, and then you can see like, okay, for this case, what do I need to set up and all that. So there's a lot of entrepreneurs out there that are CRNAs, definitely.
And your journey, you mentioned this a little earlier, the experience that it takes before actually moving it and taking that next step to become a DNP. So what would you reflect, or what are your reflections on that? Would you have made it that period, those 8 years, a bit shorter? Would you possibly have extended it? What are your thoughts on that time that you took before moving on to the next step?
Definitely, it's a competitive program to get into. It was pretty competitive for me. I was not able to get a good score on the GRE. That was probably because I'm bilingual and it's mostly English and math and all that. So that was a little limiting for me. However, there's a lot of book smart people out there, but not necessarily clinically smart. So I think I was a little more clinically smart, but not as book smart. I think both are important. And if you're missing one or the other, it still doesn't matter. Just don't give up and keep trying. And I know people that got in right away after 1 year of experience. I know people that, it took a long time, like myself. So, yeah.
You started out as a unit secretary in an ER. Would you say that's the first exposure that really gave you the idea to become a nurse anesthetist?
I was really young, but yes, I think definitely working in the healthcare field as a young out of high school gives you great exposure. You get to see how many professions there are out there. I worked in the ER, worked with doctors, and I saw that I could maybe do IVs or EKGs, and I said, okay, let me do a nursing assistant. And so I did all the IVs, which as a nurse anesthetist it's a great skill because, if nobody can get an IV, they're going to call anesthesia. So that was very helpful for me. And then while I was working as a nursing assistant, I went to nursing school, which was very helpful as well because I was already a student that had hands-on experience. So my hands-on experience was very good. I had classmates that never worked at a hospital before going into nursing school, and it was a little bit more intimidating for them. So yes.
Earlier you mentioned the importance of having a second language, being able to relate with culture, right? So just to illustrate that for students, are there any particular experiences that you remember for patients that really resonate with you and illustrate that about how you were really able to make a connection through culture, through language?
Absolutely. I think culture is very, very important. I come across, especially in my training in Tennessee, there were not a lot of Hispanic providers necessarily. And I was the only one and was a student around. And when the language line was not available, I was the one that would get called to interpret and help them. And they would want me to take care of them just because I spoke their language and understood their needs and their worries that they can't necessarily communicate directly, even with an interpreter, but with someone that knows what's going on and that's present there with them. So I think that's a very valuable thing. Yes, absolutely. Right now, we are very underrepresented in the Hispanic community, especially. There's not enough providers for the amount of Hispanic patients that can speak the language.
You also went on to create a nonprofit. Tell us about that experience. Maybe there was a learning curve to it, right? With developing it. That must be.
Yeah, that was a little bit of a long time ago. Since I was born in Colombia, I saw a lot of poverty and I always wanted to give back. And so I said, well, why not give back to kids? They don't get a Christmas. And so I decided to just get friends and family to help me collect toys. And then I would travel to different countries like Brazil, Colombia, El Salvador, and then just go randomly deliver them somewhere where I saw that it was poor areas. And just to bring them a smile during the holidays was just priceless. And, it made me feel complete because sometimes, not everyone has the opportunities that we have.
Absolutely. That type of work is really rewarding in the end.
Yeah. Mm-hmm.
Another thing is just to extrapolate off of that, how would you say that people should approach their experiences? Whether they're hoping to be nurse anesthetists, PAs, whatever profession it might be, healthcare is still patient care in the end. So what would you say, like the mindset that you should come with? Like, I'm sure certain things about those experiences, like you said, you took away and you really came to appreciate things that, you know, you might not have if you hadn't taken that experience, taken that experience. So some people might approach an experience as a checkbox, right? But I've heard of things like journaling, etc., to make your experiences worthwhile and the time that you're there more than just something on your application. Do you have anything to add to that from your experience?
I don't know if I quite understand what you're trying to ask me.
Basically, if someone's taking on an experience, right, and they're really trying to get the most out of it and make it more than just something that's listed on their application, that's the type of stuff that people often overlook. But to your point, right, you can find it rewarding if you really think about it.
Yes.
So I just wanted to ask about that.
Yes, absolutely. I mean, it's not only about being a nurse or a nurse anesthetist. You also have to advocate for your profession and be a leader and try to make a difference in the world somehow, not just by working your 9 to 5 or, you know, but maybe by helping others or like joining this Zoom so people can be informed of all the opportunities that are out there. So definitely medical mission trips, volunteering, being a leader in your unit, or all of those type of things help you appreciate different areas of your career path. Mm-hmm.
Also about the future of nurse anesthesiology, where do you see that going 10, 20 years down the line?
Well, I think it's in very system. Actually, our patient population is getting older and older. So I would say, and don't quote me on the statistics, but in, let's say 50 years from now, there will be a lot more older people than younger people. So there is going to be a very high need of people taking care of older people, of younger people taking care of old people. So there's going to be a high demand in every healthcare field. I'm pretty sure.
To go along with the application process that you talked about earlier, I'm sure there were interviews involved. Do you have any advice for students out there, you know, because the application cycle usually comes around in the summer or really this time of year, right? So I'm sure they could leverage it later on in the year once they're done with the applications and once they actually sit one-on-one with someone from the admissions committee. What were some takeaways that you had when you went through your interviews?
Through like grad school interviews or undergrad or?
Grad school mainly.
Grad school. I would definitely surround yourself with people who, sorry, my dog. Surround yourself with people that are in the field already or have a mentor. Like I had a lot of mentors and they would tell me what to do. Definitely volunteer, go on a mission trip somewhere, go donate to, I don't know, somewhere kind of facility. Anything you can do outside of the box will help you in your interview. Also work on your interview skills, you know, like you can practice in front of the mirror before your interview, write down every possible question they can ask you and study every answer as if you were in the interview. That's what I did. And yeah, you just have to stand out of the crowd because everybody's going to be a nurse. Everybody's going to have a CCRN, but what makes you special? What makes you different? And what makes you stand out are the things that you need to focus on.
Also, I'm sure really in any place, work culture really does matter. And I'm sure it does also in the OR when you're spending a couple hours right there watching over the patient. Having solid connections with the team is definitely important. For you, what have you found to be helpful for work culture? Things that might be overlooked that people might not notice at first glance.
Work culture?
Yeah, as in making sure that you have connections with your colleagues that wouldn't leave any room for confusion. I know that there's been some cases of I mean, this could apply in healthcare and elsewhere, where sometimes things are misunderstood, but it's even that much more important in healthcare when it comes to the detriment of a patient, right? So if there's any takeaways that you've had that you think people have overlooked, I mean, that's all I wanted to ask about.
Yes, definitely communication is a #1 skill. Don't be afraid to ask for help. Don't be afraid to ask questions if you're not sure about something. If you see a medication you're not sure about, look it up. If you don't know about a certain policy or procedure in your hospital, ask the question, pick up the phone, ask your neighbor. Communication is definitely important, specifically in the OR right now. For me, we all have to communicate very closely so that and it's called closed communication. For example, if the surgeon says bed up or put the bed up, I'm going to reply and say bed up, just so he knows that I understood that message and that we're both agreeing that that's happening. So closed loop communication is extremely important, I would say.
Yeah, there's definitely been a couple times I've noticed where that little repeat, it makes a difference. Another thing is, and maybe this goes along with what you already mentioned, but if not, I just wanted to ask, what would you say is the most demanding part of training when you're in school? What would you say really people lack on, right? Something demanding that you see a lot of people maybe trip up on or find as a big hurdle to actually getting through CRNA school?
I think it's different for everyone. I mean, some of us are stronger clinically, some of us are stronger with the books. For me, it was challenging. I was scared of like writing papers because, I was never good at writing papers, but I had to write so many that I became good at it. So you just have to be comfortable with the uncomfortable. And grad school kind of makes you do that. Even though you don't want it, but you also have to have in the back of your mind that this is for your own growth and for your own education and for you to be better and get better at something that you're not. And we're all scared of trying new things because we're not good at it or we never done it. But those are the things that you should be doing in order for you to grow and be good at, be a broader person.
Yeah, well-rounded, 100%.
Yeah. Yep.
Another thing I wanted to ask is, what's the bread and butter? What are the common procedures that you see basically day in and day out as a nurse anesthetist? Would you say that that's the case, or is it just too diverse to really say?
Like a bread and butter case, you mean?
Yeah. So in terms of like day in, day out, is there a particular case that you will see pretty often to the point where it's a daily occurrence?
I mean, it just depends on the hospital. I mean, if you're in a trauma hospital, you're going to get a lot of trauma patients and accidents. And, if it's summertime, you're going to see a lot of kids drowning or, sad things like that. There's always something, there's always emergencies, and you can just never anticipate what's going to happen. As far as scheduled surgeries, meaning the surgeries that are not emergent, but rather planned. I mean, there's all kinds of surgeries too. Like there's infinite amounts. There's neuro, there's cardiac, there's gallbladders or livers or kidneys. I mean, there's everything.
Yeah. So it really depends on the specialty in that case. Another thing is, and I know this for travel nurses, right? I hear that often. And also there's some locum physicians, they travel too. Is that also a trend for nurse anesthetists, that they will travel around in the same way that other professionals will?
Sorry, you cut off for a moment.
No worries. What I was saying is I see often travel nurses covering for any lack of staff, or even locums in the case of physicians who do the same. Is that the case also for nurse anesthetists? Is that a trend, or would you say that they often just reside where they are?
Yes, it's a trend for every profession, I would say. I mean, I've seen a lot of CRNAs that do travel assignments all the time. Also, anesthesiologists. There's all sorts of staffing companies that provide whatever healthcare provider you need to the hospital because they're in such shortage. So I think every profession out there can do traveling.
you mentioned in your presentation that you're pretty passionate about mentorship. If any students would be interested, is there a way that you have like an application form, a sign-up form for that type of connection?
So the easiest way is just direct message me on my Instagram. I'm pretty good at answering those. We can schedule a call, or you can email me as well. I don't have a website right now, but I am working on it. And I will definitely keep you posted on my Instagram or email once that comes around. And I don't know if you got it or not.
Yeah, on the slides.
Yeah, on the slide. Mhm.
Okay. Yeah, well, for those, if y'all want to scroll back, or feel free to screen share. Another thing I wanted to ask is, there's been a couple of speakers outside of just physicians, because with physicians, we always hear about residency and fellowship as being the ways that they can specialize.
Yeah.
I've also heard the same for PAs, and they have a lot of horizontal mobility, right, or lateral mobility with switching from specialty to specialty. And they also have residencies to add on to that. I heard that not all of them will take it, but is that the same case for nurse anesthetists? Is it possible that they can specialize in a certain area, or is the profession in general just by nature general? There's no specialty to it.
Yes, you do OB, you do pediatrics. Once you come out of school, you can pretty much do anything. You can work at a children's hospital doing anesthesia for children. You can work at labor and delivery doing epidurals and spinals. You can work at high risk OB, labor and delivery. You can work at a hospital, clinic, like you can pretty much do anything. Kind of like when nurses graduate, they can be a pediatric nurse, a PICU nurse, a ICU nurse, a trauma nurse, whatever. So yeah, you can do pretty much.
You earlier mentioned the GRE. It's definitely a stumbling block for a couple of people out there. I mean, outside of nurse anesthetists, it's also required for master's degrees, for PAs too. So it's definitely in line for a couple professions. After having gone through that process, are there any study materials that you'd recommend, any study strategies that people maybe consider? I know that study strategies are definitely variant. Those specifically, study materials are a lot more recommendable, right? Because they have certain ones will have good content, certain ones will not. But study strategies, I think, are something that people can definitely try out too, see if it's right for them. From either, though, from the material that you've used and from the study strategies that you've went through, could you share both of those for specifically the GRE?
For the GRE, I just bought the Kaplan GRE book, which comes with some practice questions. I don't think I invested enough time studying for it. For going through anesthesia school, obviously they'll give you a list of books, and your professors will create PowerPoints, and everyone has a different way of studying. For me, I had to read a lot over and over because second language, and then two, I was never the best at being good with the books, so it took me more time to learn that as somebody that can read it one time and then understand it immediately. Also, repetition is key when you're trying to learn something. If you look at it one day, look at it the next day, and then look at it the next day, and then it's gonna stay there. Also, if you visualize it or if you draw it, it will help as well. So I used to read, and then if I didn't understand something, I would read it again and then try to draw it out or put it in terms that I would understand it. Or you can also study with another person. My study partner used to understand a topic that I didn't understand. So we would get together and she would explain it to me in a way that I would understand it. And I would explain what she didn't understand in a way that she would understand it, kind of thing. So there's many ways of studying in a fun way. You just have to sit there and stare at a book or a computer. Practice questions, videos, YouTube was my best friend because I was very visual. Yep.
Absolutely. In fact, I remember an earlier speaker talked about the same thing with having a study group, having one person who might be strong in one area, yourself strong in another. You can just overlap, right?
Exactly.
Leverage your strengths there.
Yes.
earlier you mentioned the 2 years of didactic and then the 2 years of clinical that you take, right, with school. So during those 2 clinical years, I'm sure before you actually get to talking with actual patients, there's some phase of, I mean, I'm not sure if this is applicable, but I've heard of simulation programs or standardized patient programs. Do y'all go through that too, as nurse anesthetists? And
Absolutely.
if so, how long does that stage last?
Absolutely. So yeah, we had 1 year of didactics, just, study material. And then we had a summer semester, which was only like 2 months, and they crammed a lot of stuff in there for us. But yeah, we had a simulation lab. So we would go to the sim lab and we would have like the smart technology and the patient there, and the patient will be talking. And you would have to go in and demonstrate your induction techniques and how would you intubate and how, and, read what's going on the monitors and what would you do and say it out loud. And definitely we had that before we started clinical. Now, not every school is that way. Some are integrated. So by second semester, they're already in clinical, even though you don't know what you're doing. But just the fact of being in the hospital and getting thrown in the fire, you just learn the hands-on first versus the literature or the, theory.
The content.
Yeah, the content.
To tag along with that, on the other side of things, for the didactic portion, would you say that that varies also in terms of like the content that's presented or the way that it's presented? For example, I know a few schools, just in general with health professions, they might use, instead of didactic, it's a flipped classroom where when they go to class, instead of reviewing or going through lectures, they go around to ask questions or maybe do some group learning, small groups, things like that, outside of the traditional scope of things. Was that the case? Is that the case in general for these nurse anesthetist schools?
Yeah, absolutely. You have different classes. You have doctorate classes where you have to write a paper, you have to investigate a problem out there, and then you have to solve it, and then you work in groups. You have to do a doctorate project, which means, you have to find a current problem out there, and then you have to go and investigate it and try to solve it. And so it requires a lot of researching, and at times you do it in groups and times you do it solo. You write a lot of papers. We do presentations and we do Zoom meetings just like we're doing right now, so you can get comfortable talking and just being a well-rounded professional.
And to talk a little specifically about the classes, the type of classes that you took, what were those? What did you go through?
So you take a lot of advanced stuff, like advanced pathophysiology, anatomy. My school, we for anatomy, we dissected cadavers, like real cadavers, 4 hours a week. And so you get to learn anatomy like very deeply. You dissect your own cadaver, you find the nerves that you're supposed to find, you take out the heart, you look at it, you identified all the parts, the brain, everything. And that's one of the examples. What else? Pharmacology, advanced pharmacology, anesthesia pharmacology. There's so many drugs in anesthesia, so there's like 3 or 4 different pharmacology classes. What else? Health assessment. I can't remember. School was tough, so I'm having a blur.
Absolutely. I mean, nope.
Yeah.
It's been a while, and being in practice, I'm sure it all blends together. I'm sure pharmacology is a big part of that for sure. Being in anesthesiology, definitely, definitely emphasized. In terms of patient, or I should say, bedside manner, because you mentioned that at the beginning of the case, you'll meet with the patient, right? So, what's your approach to bedside manner? I mean, any tips that you have for students who maybe they're volunteering in the hospital? They get to interact just a bit with patients, have a quick talk, have some, even if it's small talk, right? How could they improve that? Make their experiences more, I guess their talks more smooth and their approach more presentable, right? When they're meeting a patient, right? A complete stranger for the first time.
Right. Just basic things, that we all take for granted, like just walk in the room, have a smile on your face, look at them in the eyes, say, good morning, my name is Kathy. I'm going to be your nurse anesthetist. We're going to be doing this procedure with you, correct? Any concerns, any questions? Like, you're pretty much providing them customer service. Is anything hurting you? Anything bothering you? Just basic conversation, and just be, how do you say, confident. Just be confident. And I know it, when you're first starting and you're really young, it's hard, but the more you do it, the better you get. And it's just, you know, you'll get better as time goes by.
Yeah. Well, as we're wrapping up the end of the session, we'll just go through a few more questions. I think one of the questions that probably might be helpful is any experiences that people can use or take right now. I mean, let's say they're going through college, maybe they're considering being a nurse anesthetist, but they're not doing the actual, BSN, the actual nursing degree. So they'd have to, take some time to switch over to that. In the meantime, though, in exploring the actual profession, what would you say are some good experiences to get a look into it? I mean, shadowing is definitely one. Anything else? Any hands-on experiences that you'd recommend?
Definitely go shadow a CRNA if you know one. Ask them if you can go shadow them, see what they do, ask them questions. Be there for a couple of hours, make notes. What else? Just read about it. I mean, the internet is out there. You can read about anything you want. You can search anything you want. The American Association of Nurse Anesthetists is a good website. It tells you pretty much what we do and, our scope of practice and all that. What else? Yeah, that's it. Shadowing is definitely a great experience.
Yeah, it's definitely direct and specific to the specialty.
Yes.
Being a mentor, I also wanted to ask, I mean, you've met with a couple mentees, you've seen, I'm sure, an array of where people are at, like a good range of where people are at. From that, are there any specific points that you think a lot of students considering nurse anesthesiology overlook, or they just don't work as well on? Anything that people might take for granted that, they should focus on while they're going through this career?
I think if you really want something, you're going to go out and do it. And that's basically it. If you really want to become a nurse, you will find a way to do it. You'll find your mentor, you will ask the questions, you will write them down, you will study them, you will prepare yourself as much as you can to become what you want to be. I have mentored some people that, perhaps I give them a little feedback on their paper or on their resume, and they don't necessarily understand why, certain things are important. So you have to be also open-minded to critique and be teachable and be, just humble and prepared to learn and just take all the information in. And yeah, I think that's a good advice.
You mentioned that you didn't really enjoy the writing part to school. Could you elaborate a little more on what that was? Was it a thesis, essays? What part of the curriculum was that for?
It was for all the doctorate classes. You had to write a lot of papers. I don't know why I was intimidated by writing. I always thought that I was never good at it. And I wasn't. So, that's why I got intimidated. But other people were afraid of clinical, just going out there and meeting a patient and putting them under. But I loved that part. I loved being in the hospital. I loved doing the hands-on stuff. I was not shy about it. And other people, I also had a lot of test anxiety. Like, that was my worst nightmare. But I became better at it. So the more you do something that you don't like and that you're not good at, you will eventually become good at it, and you will eventually perhaps like it. So you just have to go out there and do it.
100%. And just to wrap it up, one more question we have is in terms of like the type of activities you want to be pursuing. Would you say research is part of it for nurse anesthesiology? Is that something that, I mean, we hear about it for physicians, we hear about it for dentists and other professions. Is that as applicable though in nurse anesthesiology, or is it more hands-on work that actually makes a difference for programs when you're applying?
Absolutely. I think research, because books are going to get outdated. So the only thing that you mostly can rely on is articles, all the articles that come out new every year and all the investigations. If you go out and read everything, you will stay up to date with your profession, with your practice. I've worked with a lot of CRNAs that have been a CRNA for a long time, 30 years, and they said that it's changed tremendously. So they've had to do their own studying and reading and learning to catch up to what's out there now. So it's important to stay educated, continue reading articles. I mean, I mainly read articles. Also, if you have your doctorate, you can also teach. You can also go and be a CRNA professor at a university if you enjoy teaching. So those are one of the benefits as well.
All right, well, that's going to wrap up our session today. I really appreciate you, Kathy, for joining in. I do have some last reminders just for our shadowers. I just want to say, and I saw a question in the chat about this. So we do have a quiz at the end of each of these sessions. That quiz is just 10 questions. You need only 6 out of 10 or more to pass the quiz. And once you do, you'll receive a certificate for your attendance today. So that quiz will be due next week on Wednesday, April 5th. We typically have quizzes due around 6 days after each session. So for example, the next time we'll have a Thursday session, at least typically, we'll have the deadline just before that on a Wednesday. Like I said, though, this one's going to be due Wednesday, April 5th, although for the rest of this month, or actually I should say next month, April, we won't have any sessions, although we're going to be continuing in May with 2 more sessions.
Yeah.
Speaking of which, we're going to be joined by a surgical oncologist at Harvard Medical School, Dr. Naryan. He was actually on Khan Academy. He was a fellow out there in medicine before he became a full-fledged physician, but he just wrapped up fellowship and now he's a surgical oncologist. We'll see him at 7 p.m. Central on Monday, May 1st. Again, we're going to be taking the month of April off. And if y'all want to follow us on Instagram or join our listserv to hear more, feel free. Email us with any questions. Feel free to contact Kathy. Follow her on Instagram to hear more about the work that they do in nurse anesthesiology. Do you want to talk a little more about your Instagram page? If anyone would like to look it over, what kind of content you post on there?
Sure, absolutely. I post a lot on study tips or, financial aid, pretty much anything. I motivate you every day. If you're having a bad day and you look at one of my stories, you will be motivated for sure. What else do I do? I posted a lot of my journey and all, the hard times that I was going through and kind of what motivated me and how I studied and all that stuff. So it's good stuff.
Definitely give her a follow, check it out. And like I said, we'll see all of you on Monday, May 1st. So in the meantime, we hope all of you, if you are ending the semester, hope you a good end of your semester. And like I said, we'll see you in the next month. Again, thank you, Kathy, for joining in. It was a pleasure hearing about this specialty.
Thanks so much, guys. Have a good night.